Uva province, an affectionate and picturesque landscape of Sri Lanka, is made up of two districts, Badulla and Monoragala. Uva is the home for nearly 1.3 million people distributed over 8,500 square kilometers. Hidden within these beautiful valleys lie the unforeseen misfortunes of poverty, illiteracy and the dreaded chronic kidney disease. Amongst many untold stories of fallen human souls, Sandun, a young boy from Pitamaruwa, unravels a story of finding hope beyond horizon. The story begins when Sandun crash-landed and diagnosed with end-stage renal disease.
තුන්දෙනාම බොහොම අමාරුවෙන් වත්තේ දළුණු ඇල්ල තමයි ජීවත් කරේ. ටික කාලයක් යනකොට සඳුන්ට නිකම්ම ලෙඩ වුණා. එයා ගිහිල්ලා බදුල්ලෙන් පරීක්ෂණ කරලා බලනකොට වත්ගොඩ දෙකම නරක් වෙලා කිව්වා.
In the meantime, the doctors recommended Sandun to go for a kidney transplant.
ගොඩාක් අමාරුණා. ඩයලිස් දවස් සතියකට 3 පාරක් යන්න ඕනේ. පිස්සෙක් වගේ තමයි මාත්ම අපේ ගෙදර කනත් ගොඩාක් දුක් විඳා. උදව් කරන්නත් කවුරුත් නැහැ. මොනා කරන්න අපේ කාලේ ඕම ගියා. Colombo තමයි අරන් යන්න ඕනි කිව්වා. නුවර යන්න ඕනි කිව්වා. අපේ අතේ සල්ලිත් නෑ. මොනා කරන්න පොලියට තමයි අරන්ගෙන යන්නේ. කවුරුත් නැතුව අපි දෙන්නම ගොඩාක් දුක් විඳා.
Dr. Udana Ratnapala, who worked as the single nephrologist taking care of the whole of CKD community in Uva province, had an enormous challenge ahead of him.
In our resource-poor city, we couldn't provide hemodialysis for most of the patients who were in end-stage renal disease. Ultimately, we had to put a ceiling of care to provide dialysis, as well as we had to push most of the patients toward renal supportive care. Even who we gave hemodialysis, they were largely symptomatic and their survival was very poor due to inadequate dialysis. And we tried to establish continuous ambulatory peritoneal dialysis, but there were a lot of logistic issues like housing conditions were very poor.
Kidney transplantation stands out as the best renal replacement modality, as it carries the best survival rates and quality of life for both the patient and the family. Unfortunately, the translation of end-stage renal disease to transplantation in the Uva was largely inadequate due to multiple reasons.
Uva province is quite isolated from the main transplant centers in Colombo and Kandy. Most of our patients find it very difficult to travel to these big centers. Travel to Colombo, it would take 5 to 6 hours even in a personal vehicle, and even to Kandy 3 to 4 hours. And they didn't have enough financial power to go there, attend the clinic, stay there and get the transplant done. Although there was a well-established disease donor transplantation program in the country, the recipients from Uva were frequently not selected because of this distance factor. Further, we had a neurosurgical unit as well as 5 intensive care units, but the organs were very, very rarely retrieved from the ICUs as well as from the neurosurgical unit in brain dead donors. So ultimately, the live donor transplantation was extremely difficult, and the recipients were not frequently selected for disease donor transplantation. Therefore, the ultimate fate of our patients in Uva was a certain death upon dialysis.
The need to start kidney transplantation in Uva was certain, yet there were many obstacles. To assess the feasibility and to overcome the obstacles, a task force comprising of 13 consultants from different disciplines was formed. Despite ticking off most of the requirements, non-availability of a transplant surgeon was a major hurdle. At that juncture, Dr. Niroshan Atulugama, consultant oncosurgeon, came forward.
I'm a cancer surgeon by definition and technically. When I landed here in 2019, I saw at that time Dr. Udana was struggling to find a surgical backup for his chronic kidney disease patients. In terms of getting dialysis access, and also these patients had very remote chance of getting a transplant. Most of our patients are financially restrained and drained. I felt the need, there was a necessity for starting a transplant program. So apart from my cancer training, I was trained in the UK for transplants, for multi-organ visceral transplants for 2 years. So with that training, me and Udana, we thought of starting a transplant program.
Under the guidance of Ministry of Health and Hospital Administration, the required infrastructure and human workforce was developed to achieve the optimal standards to initiate the program. Making this humanitarian effort a success, the first live donor kidney transplantation was performed on 27th October 2019 by Dr. Atulugama with the support of Dr. Ruvan Disanayaka and a team from the Colombo National Hospital. Upon successful transplantation, the first ever beneficiary, Mr. Ismat, and his donor, Mr. Rinaz, now lead their lives today quite happily. The program advanced gradually to initiate deceased donor kidney transplantation in 2020.
දෙයියට තමයි ස්තුති කරන්න ඕනේ. ඒගොල්ලෝ දෙයියෝ කෙනෙක් වගේ සතපාක පිටක ඉල්ලුවෙත් නෑ. ස්පිතාලේ අපිට ගොඩාක් උදව් කරුවා.
Despite the challenges of COVID-19 pandemic and Sri Lankan economic crisis, Transplant Unit of Badulla Hospital has performed 27 live and 17 deceased donor kidney transplants to date and continues to serve the affected individuals in Uva.
දොස්තර මාත්‍රු කියන්නේ හොඳයි ඔතින් බලාගත්තා. ගොඩක් හොඳයි දොස්තර මාත්‍රු. මං ටීචර් කෙනෙක් වෙන්න කැමතියි. දැන් සතුටු ඉස්කෝලේ යනවා පාඩම් කරනවා. සෙල්ලම් කරනවා.
The meticulous commitment and dedication of many unsung heroes paved the way for the commencement of transplantation in Uva, benefiting thousands in the peripheries. The hope beyond horizon, now a reality.